So we are talking about sampling. Okay, today it's a very short class. I'll finish it in 25 minutes. Don't worry. The last class was little long, but I couldn't help it. So today we're going to discuss sampling. I selected 10 students and measured their height to find the mean height of 100 students in the class. So Anuja, can you tell me what is the sample size here? I selected 10 students and measured their height to find the mean height of 100 students in the class. What is the sample size here?
10 and
10. Very good. Sample size is 10. Okay. Sample size is 10. One student is my sampling unit. One student. Every student is a sampling unit. Okay. And the list of 100 students is called a sampling frame. Okay, these are some of the terms that you should know when you're putting up a proposal. So in this, the sample size is 10. The list of 100 students is my sampling frame, and every student is my sampling unit. Clear? So the number of units, it could be individuals, it could be households, selected from the population for inclusion in a study is called sample size. That is 10. Usually this, then the next one is a question. Okay. Usually the same as the unit of analysis. It is a unit from which information is collected in a study. Can Shilpa answer? What is that called? Same unit as the unit of analysis. It is a unit from which the information is collected in the study. Shilpa, what is that called? I just mentioned it. What is it called? Shilpa was not listening. Anyways, it is sampling unit. So every student is a sampling unit. Asha, I'm in a class. I'll call you back. Okay. Next is another question. List of every possible sampling unit with the target population from which a sample will be drawn. What is that called? Anuja, what is that called?
sampling frame.
Very good. That is called a sampling frame. Okay. So these are just terminologies. There is no big funda about it. Or a unit to another. But for most of your studies, almost all PG studies, the sampling unit is going to be is a patient. But for some ophthalmology PG thesis, sometimes the sampling unit may be one eye. Okay, opthal people will understand, because if you have a condition which is, so for some patients only one eye will have the disease, and for some patients both eye will have the disease. So it depends. In certain ophthalmology studies, you can take one eye as a sampling unit. For certain community medicine studies, it could be that one household is a sampling unit. But the list of every possible sampling unit with the target population is called a sampling frame. And now, what is this sampling? Sampling is a group of units. It could be individuals. In most of the cases, it is a patient selected from a general population. Okay, so since we cannot study everybody, we select a certain number of people. That is called sampling. But why are we sampling? Because we cannot study everybody. But in certain conditions, we can study everybody, but we would prefer to study few in greater detail with greater accuracy. For example, you are studying a measurement, a very difficult measurement from a sleep study. Sleep study, obstructive sleep apnea patients are made to undergo a sleep study. And in sleep study, you measure an ECG, you record the ECG, and in ECG, you are studying a very specific measure. Or you are a physiology postgraduate and your thesis has got something to do with an echocardiogram, some very specific measure in echocardiogram. Okay. So you can study everybody, but then if you study everybody, you will have at least 10 cardiologists and 10 different cardiologists or 10 different sonologists doing an echo, and individual variations can creep in. The measurements taken by one cardiologist may be slightly different from measurements taken by another cardiologist. Or you are a radiology PG and you are measuring something. So you are not going and measuring everybody yourself. You are taking the measurements made by your consultants or your teachers. So in some cases, you don't want many people to make the measurements. You want to measure it yourself with great accuracy. So even if you can study the whole of everybody's echo or everybody's MRI or everybody's nerve conduction study or everybody's ECG, you would prefer to study a few in greater detail with greater accuracy. That is another reason why you can sample. Clear? Okay. Examples of activities where sampling cannot be done. The most important example is your exam. You want to assess the performance of a batch of 150 MBBS students. You cannot sample 10 students and conduct a university exam only for them. You cannot do that. You have to make every student undergo the exam. Another example is your census. In census, you measure everybody. Okay, so there are only a few activities where there is no sampling done. This we have already gone through. Then what are the types of sampling? What are the different ways in which you can sample? Mainly, samplings are divided into two: probability sampling and non-probability sampling. You will understand the differences as you go along. So, we are going to talk about the easier way, which are the non-probability sampling, which are convenience sampling, purposive sampling, and snowball sampling. Let us see what these are. The situation. There are 60 children. I want to know the mean weight of the 60 children. So I decided to take a sample of 10 children. So what can I do? In convenience sampling, I take the first 10 that we see. And see, let us not waste time. Let us take the weight of the first 10 children I see, and I'll take the mean. I'll find the mean weight from those 10 children. Okay. So that is called convenience sampling. And what is purposive sampling? You know that by looking at people, you can decide whether the person is fat or thin. And if you have done a convenience sample and you happen to pick up 10 obese people, you find that your mean height is not correct. Devraj, Sailu madam is calling me. Am I audible?
Yeah, you are audible.
Okay, I'll just pick up her call. Madam,
Okay.
I am in the sampling class. Okay. Okay, ma'am. Okay, so purposive sampling is you take 5 fat students and 5 thin ones, which is my judgment, and we realize that if I take 5 fat and 5 thin, I'll get a good average. When I did a convenience sampling, the first 10 I got were obese. So I know that my sampling it was not done properly. So I just purposively took 5 fat people and 5 thin ones as judged by me by looking at them. And then I tried to get an average. That is purposive sampling. So all these are non-probability sampling because we are not giving everybody an equal chance. Then there is called snowball sampling, which you will rarely come across, but many often you utilize.
Yeah, you can
To ask those two people whether they know. You know why it is called a snowball? As the snowball keeps rolling, it gathers snow and it becomes bigger and bigger. So that is why it's called snowball sampling. So all these are non-probability sampling, which are not very scientific, but which are often used because it is very convenient. Now we'll come to probability sampling. Probability sampling is where every individual has a known or equal chance. You can't say that everybody has an equal chance in all probability sampling. But even when they are not having an equal chance, we know what is their chance of getting it. You don't need not know, it is a very scientific term, but you should at least understand that when you're doing probability sampling, people are getting a chance of being in the sample. Okay. So first is simple random sampling. This is the best way of doing it. So the simple random sampling, what we do is you obtain a list of all sampling units. Like if I want to sample, I get the mean mark of 150 students of Alleppey Medical College 2018 batch. I need to get a list of all students. I need to have a list of all students and their marks. Then I assign each unit a unique number. That is a serial number. Then based on the sample size, suppose my sample size is 10, like I showed in the first example, my sample size is 10. What I do is I randomly pick up the required number of units from the list of units. You will understand when I show an example. So if I want to select 10, I want from a batch of 100 students, I want to pick 10 people. So how do I randomly pick these 10 people? That is what I'm going to tell you. I can do the lottery method. I can make chits with numbers from list 1 to 100 and lottery I edukka. Then I can use a currency note method, but all these are obsolete methods. Now what we do is I ask the computer to give me 10 random numbers between 1 and 100. What do? I need to select 10 students. So I ask the computer to generate me 10 random numbers between 1 and 100, including 1 and 100. So when I just before this class, I asked, before I made this slide, I used the computer and asked the computer to generate me 10 random numbers. So the computer gave me these numbers. And I already have a list of all the students in my class. And I have given each them a number, 1 to 100. So if I want to take a sample of 10, I'll take the 94th student, the 51st student, 59, 20, 19, 56, 26, 73, 72, and 22. Okay, so this is simple random sampling. So everybody gets, from first person to 100% is getting an equal chance of being selected. That is simple random sampling. This is the most random and the best method. But the biggest disadvantage of this method is that we need the list of all the 100 people. We need to know who the 94th person is, who the 51st person is, 59. Everybody you should know. So it may not be always possible. Okay. And you need to generate random numbers. It has got another disadvantage. Okay, that disadvantage is addressed by the next method of sampling called systematic random sampling. Karthi madam, if you look at these numbers, can you tell me what is the problem with this? These set of random numbers. Just 19, 20, 40s are missing.
Yeah, certain areas are totally missing.
Yeah, and which is the major area which is missing?
20 to 40.
Yeah, but what about 1 to 20? I
1
thought
to
1
20,
to 20.
19 and 20 are there.
Yeah. So I don't see any number below 19. Okay. But there are a lot of 50s also. This is very likely to happen. This is not our problem. It is a randomly generated sequence. So how can you address that? So is that a problem? I'll tell you an example. If my first MBBS admission is going on, okay, and somebody wants to find out, check the IQ of the people, check the IQ of the mean IQ of the people who got admission, who got admitted to medical college. Okay, mean IQ of the people who got admitted to medical college. So the attendance register has not been written, we go to the office and the office people will give you a list. What is that list likely to be? The first numbers will have the higher ranks because their counseling happens in that order. അങ്ങനെയല്ലേ കാർത്തിയ madam? If you just go and get a list now,
അതെ
the first numbers will be the higher ranks.
അതെ
Okay, and suppose I am going to sample these numbers and get the IQ. What has happened here? The first 18 rank are missing in this. Okay, so the mean IQ I take from this sample, though it is a simple random sampling and the calculated sample size of 10 is adequate, I will not get a correct this thing. So how can you address this problem? You want every part, madam പറഞ്ഞ പോലെ തന്നെ ചില ഭാഗങ്ങൾ missing ആണ്. You don't want that to happen. You want every part of the sampling frame to be part of your sample. So what can you do? So I'll tell you how to do it. Systematic random sample is used when there is concern that all parts of the list need to be included in the sample. How is it done? So what you have to do, divide the total listed population by the desired sample size to get what is called a sampling interval. So my required sample size is 10. So I divided my total population of 60 by 10 and got a sampling interval of 6. Now I select randomly a number between 1 and 6. So I got 4. Any method, lottery or random number generator, anybody. So I selected 4. So this is the first sample unit. The first person to be selected is rank number 4 or person number 4. Then I keep adding 4 to this. 4 plus 6 is 10. 10 plus 6 is 60. Then I add the sampling interval. So what happens? Everybody from the beginning of the list, even if it is not first person, everybody from the 4th person to the last person around the last batch or bunch of people will also get included in the study. So systematic random sampling gives a better representativeness when you are looking at certain sampling methods. Okay. Then another method is called stratified random sampling. It is used when the population is comprised of strata based on variables which relate to the variable under study. Suppose the variable under study is height. You know that height of males are definitely more than females. So if there are, so you want to, you are studying something which has a strata, which is male, which has got something to do with height. Okay, you have males and females, 2 strata, which has got something to do with height. So what can you do? So if you want to get a correct estimate, you want to have an equal number of, not equal number, proportionate number of girls and boys in your sample. So what do? Your sample has 60 students and it has 40 girls and 20 boys. Okay, that is 67% are girls and 33% are boys. So the sample of 10 should also contain 6.7 girls and 3.3 boys, or otherwise 7 girls and 3 boys. That is stratified random sampling. Okay, so these are the 3 probability sampling methods that you are likely to use. Then for community medicine PGs, there is another method called cluster sampling. Or sometimes if you are a pediatrics PG or you are any clinical PG who are trying to study from schools or old age homes, you can employ cluster sampling, but most often cluster sampling is done only by community medicine PG. So I won't go into details of that, but I'll tell you what it is. A cluster is a naturally occurring group of individuals. That is one ward of a panchayat or one school in a district. So what do you do? You can't study everybody. Like you can't go to the ward and make a sampling frame and then do a simple random sampling. It is very difficult. So what you do is you do called cluster sampling. That is, you select certain clusters and study a certain number of people from each cluster. Suppose there are 8 wards, you study 30 people from each ward. That is called cluster sampling. You need not know the details. If you are a community medicine PG, you will have to learn it. So I will not, it is beyond the scope of the class to explain cluster sampling. So these are all about sampling methods. Now we'll come to the last 2-3 slides. Most often when you have a sample size which is moderately high, you will be forced to include all patients during your study period. We will, most often a PG student will not have the luxury of sampling something. Suppose you're a pathology PG and you are studying some kind of a malignancy. Even if you collect data for your whole study period, you will not be able to meet your sample size. Then you should understand that you are not doing any sampling here. You are including everybody that comes across you during your study period. Then there is no sampling. Karthikeya madam, you agree with me, no? There is no sampling in that case.
Yeah.
Yes, there is no
Certainly.
sampling.
Because
so the question
if we
is,
can take, you can take all the people attending OP or in your department for the past 1 year or
yes,
following 1 year. So you have to include all the patients. So that is, you
Okay.
can expect in the protocol also you can write, you are expecting a sample size of 100 or whatever it is. So that is what you can write.
Thank you, madam. That is exactly what I want to tell. If there is 132 is your sample size, okay, and you will have to study everybody that comes across pathology department to get 132. You can write in your protocol that my sample size is 132, okay, but since the number of patients is low, I will include all patients during the study period of 1 year in my study. And probably you can add some one line saying no sampling done. Is it necessary? Some protocols we write no sampling done, all patients are included. അങ്ങനെ എഴുതിക്കൂടെ madam? You can write that, no? Or you can write എഴുതാം. There is no sampling done.
ഒരു കോളം ഉണ്ടല്ലോ അങ്ങനെ സാമ്പിളിംഗ് സൈസ്, സാമ്പിളിംഗ് ടെക്നിക്, സാമ്പിൾ സൈസ് എന്നൊക്കെ പറഞ്ഞിട്ട് പ്രോട്ടോകോളിൽ ഉണ്ട്. അപ്പൊ അവിടെ നോ സാമ്പിളിംഗ് എന്ന് എഴുതാൻ പറ്റും. ബട്ട് വി ആർ എക്സ്പെക്ടിങ് എ സാമ്പിൾ ഓഫ് whatever it is 132 based on the past year's experience.
Okay.
അനൂപ, കാർത്തിക പറഞ്ഞതുപോലെ അങ്ങനെ എഴുതിയില്ലെങ്കിൽ എന്താ പ്രശ്നം എന്ന് അറിയാമോ? ചിലപ്പോ ചിലർ നോക്കുന്നുണ്ട് സാമ്പിളിംഗ് ഒന്നും പറഞ്ഞില്ല എന്ന് പറഞ്ഞ് അവർ ആ പ്രോട്ടോകോൾ റിട്ടേൺ ചെയ്യും. അതുകൊണ്ട് ലൈക്ക് പറഞ്ഞതുപോലെ വി എക്സ്പെക്ട് എ സാമ്പിൾ സൈസ് ഓഫ് അറൌണ്ട്, അതായത് നമ്മുടെ OP-യിൽ കഴിഞ്ഞ മാസം ഏതാണ്ട് ഇത്ര പേഷ്യന്റ് ആവുന്നത്. സോ വി എക്സ്പെക്ട് ഡ്യൂറിങ് ആ സ്റ്റഡി പീരീഡ് ഇത്ര സാമ്പിൾ, അതായത് നമ്മുടെ
all those will be included in the study.
Yeah. ഇപ്പം പിന്നെ വേറൊരു ഇത്, നമുക്കിപ്പോ ഒത്തിരി പേഷ്യൻസ് വരുന്നുണ്ട്, നമുക്ക് കുറച്ച് സാമ്പിൾ സൈസ് മതിയെങ്കിൽ നമ്മുടെ സ്റ്റഡി ഡ്യൂറേഷൻ കുറച്ചിടുക. ചിലപ്പം എന്ത് ചെയ്യും, ചിലർ ഒരു ദിവസം ഒരു പേഷ്യന്റ് എടുക്കും, പിന്നെ ഒരു മാസം കഴിഞ്ഞ് എനിക്കൊന്ന് കുറച്ചുകൂടെ നല്ലത് വെൻ യു സ്റ്റാർട്ട് യുവർ സ്റ്റഡി യു ഡു ഇറ്റ് കണ്ടിന്യൂസ്ലി ഫോർ 1 month.
Yeah, I am coming to that. That is exactly what I have put in my next few slides. Karthikeya madam and Sairu madam, I want your inputs on the next 2 slides, okay? Because I am going to tell something which I like, which is not there in any textbook. Suppose you are studying a proportion or mean of a disease or a parameter from OP or IP or both. So your calculated sample size is 120. Actually, if you sit and make a good effort, you will be coming across 400 patients. Okay. Then you can sample this 120 out of that 400 patients. Then to improve the quality of the study, you can sample, and I think you should sample. So how can you do that? The methods I just mentioned, no, simple random sampling and stratified random sampling, all that can be done only when you know the sampling frame. But when you are studying something like this, you don't know the sampling frame. You are taking people as and when they come to the OPD. So what can I do? So what I am trying to tell you, when you are sampling, when you have more number of cases and you want to select 120 out of 400, make sure that you include patients from all units, all days of the week, all levels of physicians, from professor to house surgeon. Try and avoid specialty clinics and all months of the year during your study period of 1 year. Madam, you have any comments on this slide? Saidu madam? She's lost. Karthika madam?
Usually what happens is people will take samples or units from some of the OPs where at their own convenience. And what we
Yes.
can write is only this is a convenient sampling. You cannot write simple random sampling. It is only convenient sampling. That is what finally happens. That is what I think.
Yeah, but don't just look at your convenience. Try and make your sample as representative as possible by trying to include all units, all days of the week, all level of physicians, and all months of the year.
Anuba, I have a comment. Actually, I'm in the midst of something else. That's why I'm disappearing in between. I
Okay.
have a comment. All months of the year means like they will have. I would like them to restrict their data collection to the minimum period because they are PGs.
Okay.
Because of
So
various
what I'm trying to tell you, ma'am, if you're looking at something like a malignancy, okay, there are around vacation period, around Onam vacation when the school closes, people tend to come to OPD to show their tumors, and then there is an increase in number of tumors being operated during the vacations. You know what I mean?
Yeah, I understand that, but
Yeah.
then you should not expect too much out of a sample coming to the hospital because it depends on so many factors like this.
Yeah, but what do you think about including all units and all level of physicians?
Other fours are very practical and very much I too would go with that. But last one, I feel sometimes there would be a danger. Like I would advise that this is not from the sampling point of view. This is from the practical point of view. It is better to finish off the data collection like as early as possible. This is not at all
Okay.
related to the sampling. What do you call that?
Practical. Yeah, I understand, ma'am. But I think if they are taking 1 year, they should try and include all months.
Exactly. Yeah. If you're going to write in your protocol, sorry, if you're going to write in your protocol that you will be taking 1 year to complete your data collection, then this is very important. Or if you're writing, okay, I will take 120 samples, 120, and you're going to get that 120 as early as possible, then you should not write that your period of study is 1 year.
Okay, yeah, exactly. If you are right 1 year, then you should include all months. You should try. All these are try and include. Okay, there is no hard and fast rules. Because you know that every unit patients are different. Patients are treated different. The kind of patients that come to the OP is different. So try and include these things. Try and do these things, and it will definitely improve the validity of the study. Okay, or you will be measuring what you're trying to measure. Otherwise you will get a skewed value, a skewed mean value, or a skewed proportion. Suppose you're trying to find the prevalence of a tumor. I am sure if you study it during the summer vacation, now this corona and everything is different, but earlier in and around summer vacation, all tumors present to the hospitals to get operated. Am I not right, madam? So you might get an increased proportion than what is expected. Okay. So another thing you can do is if you're comparing two groups, like you're comparing the means of two groups or comparing the proportions of two groups, you should try and match for some confounders. I'll give you an example. Suppose you are an anesthesia PG and you are looking at some anesthetic procedure. You make sure that you have an equal number of cases from casualty OT and general OT and gynec OT. Because you know that the kind of patients that get operated under casualty OT is different from general OT and gynec OT. Okay. Or you're doing a suturing technique, you make sure that you have around the same number of diabetics in both the groups, because diabetes will definitely affect any suturing or any procedure, any antibiotic, any drug. If it will be affected by your diabetic status. So if you're comparing two groups, again, you try and make the two groups as equal as possible. You cannot randomize here. You cannot match for everything known, but at least you make sure that you don't have one group having, sorry, you don't have one group having lot of diabetic patients and the other group having very less diabetic patients. Any comments, Makarthi madam?
Yeah, because if the study, for this study, diabetic should not be a risk factor.
Yes.
You should not
As
match
far
for a
as
risk
I know,
factor.
madam, diabetics affects every outcome. I know, I can think of. So,
but if
yeah,
you are
I'm
studying particularly diabetes as a risk factor, you
yeah,
cannot match for it.
Okay. But that you should discuss with your guide. But if you are studying something which is where your diabetes is just something in the background. Like you are studying suturing technique, testing between two suturing technique, and you are looking at the pay, you are looking at the number of days of stay in the hospital with suturing material where you can get a better healing and send them home earlier. You make sure that both the groups have around equal number of diabetics. And if you're looking at pain relief between two anesthetic medication, you make sure that you have people operated from casualty OT and general OT and gynec OT. Clear? So when you, it is very difficult to do sampling. The ones I mentioned, the systematic random sampling and the simple random sampling, in a hospital setting, it is not very easy to do because most often you will be forced to include everybody because you're getting hardly 6 months to 1 year for your data collection. So there is no sampling done, but at least make an effort to make your sampling a little more meaningful. It shouldn't be like the convenient sample, let us get the first 10 and measure their height. Okay. So it should be purposive to some extent, but there is no hard and fast rules. I'm just giving you some tips to improve the quality of your study. Thank you. Devraj.
Yeah, ma'am.
Yeah, so that is the end of the class. I want to thank Dr. Sailu madam and all the faculty and Devraj to let me be part of this research methodology. It's been wonderful being with you, and thank you so much. Please give your feedback. If you are you getting a feedback form in
No.
this?
Yeah.
Are we putting a feedback, Devraj?
Ma'am, in the Moodle itself,
Okay,
there is
okay,
a
okay.
feedback.
Moodle
Session
must
by
be
session,
having. If you get any specific feedback, good or bad, please share with me. And
Okay.
I wish all the PGs best of luck. Please get over your inhibition, start writing your protocol, and all the best for your thesis and all the best for your course and career. Thank you.
Thank you, Anuba, because you have given talks which are practical, which are very down to earth, and maybe like you see in books, statistics made easy or something like that. So these topics made easy and palatable. So thank you so much for your time, and of course you are part of the team. So let's see how this gets on. And to all PGs, thank you so much.
Thank you. Thank you.
PGs are actually responding in the chat windows, ma'am. They are thanking you for the classes.
Okay. And can I see the chat? Yeah. Anyway, I'll have a look. I think I need to stop sharing to see the chat. No? Yeah. Yeah, thank you. Thank you. Can I leave?
Yeah, just one moment, Anuba. And PGs, if you have any doubts as you come across your Moodle or anything related to or something which you want to ask us, I think you can. How do they do it, Devraj? They can.
They can actually respond in the WhatsApp groups.
Yeah, in the groups.
Yeah, and the group. There is something to be clarified. It can be sent to our RWA group and we'll forward that.
Anuba, this won't be, I mean, once they all finish, maybe I don't know when, let us see. We will have a final Zoom also.
Yeah,
so that time, please be part of us.
Okay, thank you, ma'am.
Yeah.
Thank you.
It's tentatively, it's on 23rd, ma'am. Tentatively,
Let us see. Let us see. Okay.
Yeah.
Okay.
Okay then. Thank you. Thank you everyone. Good night. Thank you.
Good night.
Okay, thank you, ma'am.